York University Professor Tamara Daly has been awarded $800,000 over 5 years to lead a research program studying the health impacts on those who work with seniors in long-term care settings, with a particular focus on gender issues.
Part of the goal is to really better understand what working conditions and living conditions are like in these facilities, and to get a sense of how we might improve things in order to improve worker health and safety, but also resident care. The majority of people that end up in long-term care facilities are women. The majority of people that work in long-term care facilities are women, so it's a highly gendered site of care, it's a highly gendered site of work, and we don't tend to think of it in these sorts of ways.
The funding for her research is part of a 5-year research chair from the Canadian Institutes of Health Research. The funding will be used to train and mentor the next generation of researchers and will help Professor Daly focus on communicating the research results.
So I'll be attending more conferences and doing the sorts of things that allow me to connect directly with community organizations that are best able to use the research in a way that makes sense to them. So community organizations or long-term care facilities that can change their practices in order to better focus on working conditions and living conditions for residents. There is a necessary connection between good working conditions and good living conditions. And so if there are good working conditions for workers, then there are good living conditions for residents. And if we forget about that link, I think it creates problems.